is 5 o'clock. We're here at St. Croix County Health and Human Services Board and room 1400. I'd like to call the meeting to order. Roll call, please.
Sean Anderson.
Present.
Mike Barkalow.
Present.
Kathleen Finley.
Present.
Kathy Leaf.
Present.
Lisa Lind is excused, correct? Deb Lindeman.
Present.
Julie Smith.
Present.
Greg Telejohn.
Present. Thank you. We have a quorum. We're going to make a little change on business items. 4 will become 5 and 5 will become 4. So change that order a little bit. Minutes were in our packet. Is there any changes or corrections or additions to the minutes? If not, they'll stand approved as presented. Any public comment? No, there's nobody here for public comment. So we'll get right into the business items. Financial report for August 2025.
Thank you. So the financials that are in your packet are through August of 2025. We are pretty much just trending the same as we have been for the last several months. So our purchase services and behavioral health and children's services are continuing higher than we anticipated, but well, they're continuing on that same trend. The healthcare campus is also pretty much on the same trend. We do have the admissions in Kitty Roads. It will take a little bit before they have enough admissions to cover the staffing for that to start showing that profit. So right now they're still showing a negative balance. And then Orchard View and the nursing home, again, they had those payment back to the, they paid their transfer back to the debt service, and so it will take for the rest of the year to kind of get that expense evened out. Any questions on the financials? Okay.
Guess not. Next up business item is consideration of 2026 budget requests.
Thank you, Chair. Let me scroll down. I'm filling in for Ken today. He can't make it, so I'll do my best Ken and press.
Stunt double.
Yeah, my best impression of him. Not too good though, so I don't get invited back next year. So he can, get his job back.
We do need a joke from you.
All right. All right, so a little bit background on the budget process. We started out, the department heads put in their position requests for the next budget year. They submit those, Ken puts them into this fancy spreadsheet and plugs it into the system. And then we basically carry forward the 2025 budget for operating expenses and revenues, and then department heads can make changes as needed. We then schedule meetings with each department head and kind of go over the budget on a line-by-line basis and see where changes might be able to be made or expenses reduced or added if needed as well. So once everything was submitted this year, we were about $600,000-$700,000 over budget. So it was actually a lot better than prior years where we were well over $1 million a shortfall. So we started off at a better point this year, but still had ways to go. And so a couple things that we did find this year were a little different and maybe led to that change in not having quite the shortfall as prior years is kind of the wage grid. It went into place about 10 years ago. So we have 19 steps in it, started step 1 and at step 19. Lately, we've been able to hire employees at step 1. So employees that are retiring, maybe at step 14, 15, and we're replacing employees at step 1, so we're getting that cost savings from step 1, step 14, 15, whatever it might be. Whereas in prior years, we were kind of having to hire people at step 5, step 6, just to get them in the door here. So we're kind of seeing a little bit of savings there as people are aging out, retiring, and getting new hires in. And the other change is kind of while our health plan went up 2.8%, we actually are kind of seeing a savings in some departments, and that's kind of just because of the changes that have happened. Some employees are electing to go with their spouse's coverage, so they're dropping off the county health plan. So we're saving anywhere from $10,000 to $25,000, depending on what kind of coverage they had, single or family. I'm going to skip over the summary page, and I'm going to start at the department levels. And so when we look at each department, we usually focus on a few things. The first is the general property taxes. That's the tax levy for the county. And we also look at our net wage and fringes. And then we'll look at our operating expense lines at the bottom. And so we kind of focus on what the requested budget is for 26 and compare it to what was requested for 25. So as we start in public health, our property taxes actually went down $83,000. So we kind of look to see what drives that. Our net wage and fringes, those went down $157,000. And that's due to a realignment in 2025. We had 2 positions, we turned it into 1. The epidemiologist and the public health educator became the public health strategist. And so that's where that savings is from 25 budget to 26. As we scroll down and we look at our operating expenses, we're actually up $71,000 there. And that's basically driven by the other professional services of $80,000. And I believe that was the nurse practitioner consortium and I think it's offset by some grant money. Is that correct? Yep. And then the other change was a decrease in purchase services of $33,000. And I think that was more so just the difference between purchase and other professional, just kind of a accounting correction there. So stop me if you guys have any questions as I go along. As we get into behavioral health, our general property taxes went up $485,000 for requested budget in 26. We also had a decrease of $100,000 in judgment and damages. This is our opioid settlement. It actually wasn't a decrease. It was just kind of a split between, we put it in the correct department where the costs are. So the other revenue for the opioid went to children's services. If we look at our fringe wages, we were up $218,000. And this was due to a couple of position requests that were for 26. One was a behavioral health technician, which was partially supported by grant revenue. Ken likes those ones that are supported by grant revenue, so he's leaving that one in there is the plan. The other one was a behavioral health administrator, which was roughly $150,000. And talking with Bob in one of our meetings, kind of the realignment, the restructuring of the departments and what everybody's doing, we felt that that position was okay to not be approved for this budget year. So at this time, Ken's declining that position. As we get down to our operating expenses, we were down $75,000 in that one. And that was driven by a couple things. The purchase services, we were actually decreasing $160,000. We were eliminating a couple beds at Northwest Transitions. And then the other change was a $50,000 other contractual services. That was a SOAR Onyx grant. So that's offset by grant revenue that we're going to receive. As we move to CCS, this department does not have any property tax revenue associated with it. The net wage of fringes increased to $74,000. That's just kind of a standard growth for the increased wages and then fringes. And the operating expenses, they went down from, sorry, I went too far. Sorry, behavioral health operating expenses went from 2.6 million to 2.5, so a decrease of about $75,000. And that was due to a decrease in the purchase services in this department as well. So while we have historically seen an increase in well over what we're budgeting for next year, we're seeing a decrease in enrolled clients, and we're also working with providers to provide services within the community to try and save us some money as well. CCS department, general property taxes. Oh, sorry, I already did that one. Economic supports, we went down $60,000 in general property taxes. And that was driven basically by a decrease in net wage and fringes. So this is kind of a department that shows where we might have had some retirements that were retiring at the higher step in the wage grid. They're being replaced by newer hires, so we actually went down in wages. Then you also see that the same thing with health insurance plan. Might have had more people on the family plan before that retired, left the county, either single or no coverage, came back as a new hire because we were down $40,000 in health insurance in this department. There was really no changes in the operating expenses. It's a very labor-driven department. There's not a lot of operating expenses to begin with. Children's services, we went up in the general property taxes $283,000 from 2025 to 26. We also are expecting to receive extra grant money this year, in 26. So we have a $160,000 increase there. And again, the judgment and damages, this is where the rest of that opioid money is allocated here. So as far as total wages and fringes, we went up $636,000 in this department. That's due to 3 new positions as well as a move that happened in 25. So in 25, we moved a case manager from behavioral health to children's services. So that's part of the increase. The rest of it is the 3 new positions that are being requested. One is a physical therapist, and then an occupational therapist, and then also a case manager for the CLTS. And so that's the reason behind the wage and fringe increase. If we scroll down to operating expenses, we really didn't have too much of an increase there. It actually went down $47,000, so 3.1 to 3.06. And that was due to a decrease in purchase services, which part of the decrease is related to the occupational therapist and physical therapist having employees versus having to purchase those services. This is also where the court order placements go. As you know, those are a lot of out of our control. There is a youth that is going to be aging out next year, so we're expecting that to decrease a little bit, hopefully, but who really knows for sure. The ADRC department, we had an increase of $165,000 from last year to this year for general property taxes. So what's driving that? Our total wage and fringes are up $109,000. There's 1 new position request in here. Ken is not recommending to fill it at this time. The request is for a resource specialist. We did approve 2 resource specialists last year for this department, so he's kind of recommending at this time to see how a year's training goes, how the people are on the job for a while, before we add any new positions to this department. As far as operating expenses, we are up $22,000 from 25 to 26. This is being driven by the catered food. If you've been out to eat or to the grocery store lately, it's getting expensive. That's just being passed on to us as well. The other expense that's increasing is a cell phone from 14 to 22. We've had some sites that are eliminating internet, and then just the van drivers making sure they have a phone in case anything happens while they're transporting residents around. The administration department, this went down $267,000 from 25 to 26 for property taxes. And actually, we really did not have much of a change in wages, so it went up 49,000. That is just kind of your standard step increases there. For operating expenses, we went, so it's a little confusing. We have this overhead. It's kind of just a collector. So the administration costs get allocated to the CCS department, and so that's where it hits here. So it's a little deceiving because you can see our operating costs last year in the budget were 287, whereas this year the 45. There really wasn't much of a change if you go line by line. They're pretty standard from 25 to 26. As we get into the healthcare campus, we're going to focus on the overview rather than each department for the healthcare campus. Healthcare campus is an enterprise fund, so there's no tax levy going to the healthcare campus. So the big change in their revenue was to the institutional care line, what they charge the residents. It went up $683,000. A few things driving it, the Medicare rates, the kiddie roads, and just higher occupancy rates. For the total wage and fringes, we went from 7.5 to 8.8, so an increase of $551,000. We have 2 new positions in this department, or with healthcare campus. One you've heard about before, the assistant healthcare campus administrator. It was brought as a budget amendment, which needed a 2/3 vote. We didn't quite get the 2/3, so it was voted down, but we did have a majority. So we're leaving this in here as a request for next year, whereas to approve the budget, we only need the majority to get that position in there. And they feel that it's a very important position. And the other one is an admissions coordinator, just to kind of deal with all the complicated admissions that come through the healthcare campus. For operating, all the way down here, for operating expenses for the healthcare campus, we are up 1.1 million. One of the things that's driving it, you can see at the bottom here, is the debt service transfer that Faye touched about just a little bit ago. So in 25, it was budgeted at $500,000. In 26, it's going to be increased to $750,000. This is the transfer to the debt service fund, which then reduces our debt service tax levy. So a couple other things driving the increase. If we go up to purchase services, we went from 844 to 962, an increase of over 100,000. This is where our food service is in. So again, just the rising costs of food to provide meals to the residents. Right above it, the purchase pool staff, that went up 90,000. As you can see, historically, it's hard to keep the healthcare campus fully staffed, and we've needed to outsource those additional staff, and so we're just trying to get this more in line with what it has been historically. The water and sewer went up $14,000. There was a request to put in a new water filtration system at the healthcare campus. And then just a couple supply line items. So nursing supplies and unbillable went up $30,000. Again, increase in cost of things, and kind of the same along the operating supplies went up another $10,000 as well. And then they are also requesting to purchase some lifts. I think it was 2 lifts for the healthcare campus. I can't remember the exact number, but trying to replace lifts as we can going forward every year. Instead of doing it through the KIP, we're doing it through the department itself. This will just help eliminate injuries lifting residents, and easier for staff and safer for the residents as well. And as we scroll down to the last department, we have veteran services. No real changes in there. Our general property taxes went up $9,000. And this is basically just driven by the fringe and wages went up $9,000 as well. Any specific questions that I can try and answer, or Faye or Bob can as well? And then just a note, so this is when you're seeing it for the first time. This is the best time to make recommendations. So Ken's just kind of looking for things that you might want to see changed in the budget. You will see it's at the Committee of the Whole in October, and then the recommended budget will go to admin in October, and then it'll go to the full county board for approval the 1st of November. It's just easier to make changes between now and when it goes to Committee of the Whole rather than after Committee of the Whole.
Nothing? Oh, go ahead, Bob.
Thank you, Dustin. Appreciate that. There was one position that we requested for 26 that I don't think I heard you mention, but it's a .6
The admin,
admin position for the offices right over here. We don't have administrative staff there to greet anyone that comes in or to assist our professionals that work there. So the idea was, now that it's licensed, where we can provide therapy and have appointments there, it would be helpful, I think, to us as a department to have someone there at least part-time to greet people and to assist with all the administrative duties that go with that. So that's a .6 position that we'd be asking for in the 26 budget. Most of the positions, as Dustin pointed out, that we asked for either have partial grant funding, they're funded through Medicaid, or we're offsetting them through a reduction in contracted costs like Dustin mentioned. So we're trying to be as frugal as we can be. That position, if we got it over there, would be tax levy, but relatively minor expense in the whole scheme of things, and we think it would generate more activity for our department.
yep. And it was in the admin budget at a .75 it was requested for, I think. But Ken's recommending to approve it at a .6 for next year.
Well, thank you.
All right, thank you.
Next item is number 4, which is Wisconsin Department of Health Services update impact of reconciliation bill on Wisconsinites.
No, we're number 3. Yep. Community health.
Oh, I missed,
Yeah.
Sorry.
Ellie's like, wait a minute.
We can eliminate her. No.
I'll be short and quick. We'll get to that right away. Good evening. Here just to discuss, and let me scroll through all these numbers to get to things. So I'm here representing public health and our community health assessment and our community health improvement project, also known as the CHON CHIP. Some of you are intimately acquainted with this process, and maybe some of you are not. So I'm just going to kind of review why we do this and what it really is. So we do this, one, because it's great for our community, but it is also required by state statute. So under state statute, any public health department is required to conduct a CHA and subsequently a CHIP. It's under Chapter 251. It's got a lot of nice verbiage, but basically what it means is we need to do an assessment to identify what are the critical health needs of our community. And then following that assessment, we need to develop a community health improvement plan to address those priorities. So so tonight is just an update of where we are in that process. So far, we have conducted our community health assessment, so looking at our community needs. So we've done a community health actual survey. This came out actually in the summer of 2024. And this survey, we had about 700 people respond throughout the county. And kind of our biggest concerns that came out of there were mental health, access to mental health, and actually third being safe and affordable housing. So following that, then in 2025, we transitioned to findings from key informant and focus group interviews. So basically, we had the numbers counting why, how many people thought it was important. Now, why is it important? So we really relied on key informant. So individuals who kind of had that intimate knowledge, whether through their organization or through personal experience with identifying the top health priorities. We also really focused some of those conversations on mental health because mental health has been a priority underneath St. Croix County's CHA-CHIP process for the last 2 cycles. So why is it still popping up? What haven't we done, and what could we do? So we really curated responses around mental health as well through these interviews. And then the third piece that kind of completes the assessment is a secondary data dashboard. So that's basically this monster kind of slide deck of all the data that really paints a picture of the conditions and the health conditions of St. Croix County as it stands. So all of these three pieces can be shared with you. Kind of the goal now is all of this traditionally has been housed on our Healthier Together website. Some of you may be familiar with Healthier Together. It's our large coalition with Pierce County and St. Croix County and all of our healthcare partners and lots of members and organizations included. That coalition used to drive this process. But as we've transitioned where the healthcare centers, Alina, Western Wisconsin Health, and health partners no longer need the local health departments as much in that process, and kind of our schedules have all shifted, we have now separated. So Pierce has done their own process and St. Croix County has done kind of our own process. And our needs may not align as well. So all of this will be shortly posted on our website for individuals to kind of dig deeper into. But where we are now, so in that community health assessment process, we've now done the survey, we've now done the interviews, we've now created that secondary data dashboard, and so now it's time to actually determine the priorities. So what we did is we did a community needs forum in partnership with UW Extension. So this was held last month here in this building, and we went through all of that data. We had over 40 partners represented. We went through all of that data, kind of summarized all those needs, and then we had a discussion. What were they seeing? Were they really seeing their the needs that they had identified? Were they reflected in kind of what we had presented? And let me just make sure I don't miss any points for you. So what we did is we did 2 rounds of voting. This is kind of traditionally how we've narrowed down what we work on. So we used the results from the survey kind of to give us those initial points, and then we narrowed down. Some great discussion resulted from that prioritization process, and we have now come up with 2 draft priorities. So ending out this year is really the kind of those priorities, that priority setting, and then we'll move into the actual plan. But we need the priorities to frame that plan. So the first priority that came out of that plan was mental health, and the second being social and community conditions. Now, they're written as draft because only today were they presented to our internal public health team. So we really are still in this draft process, and they are being presented to you all as well as drafts. So any feedback is encouraged. I'm going to read quickly our kind of just the description of this priority for St. Croix County. So, mental health is essential and deeply connected to our quality of life. Mental health affects our ability to manage stress, maintain relationships, succeed at work or school, and take care of ourselves and our families. By improving access to mental health services, strengthening crisis care, promoting overall emotional wellness, our community can help ensure that everyone in St. Croix County has the opportunity to live well, both day to day and over a lifetime. Okay, so moving on to the second draft priority, social and community conditions. Social and community conditions shape the environments where people in St. Croix County live, learn, work, play, worship, and age. These conditions influence health outcomes, daily functioning, and overall quality of life. They include a wide range of factors such as access to safe and affordable housing, aging and disability resources, and other community supports. Every community within St. Croix County is unique, and therefore social and community conditions may look different across our county. Addressing these factors can help create a healthier, safer, and more supportive environment for all St. Croix County residents. So those are kind of where the priorities sit in draft. Very shortly, we are going to kind of just finalize them within our own internal department and any other kind of input we have requested, that people kind of give us feedback that this is what we've drafted. We want all of our partners, this is a community work, we want them to see themselves in these priorities. We want them to be able to partner with us and actually make an impact through either new work, continued work, or something innovative that maybe we haven't thought of, but other people have heard of before. So As we move forward, as you said, we are now at the priority setting. Next steps being those partner action plans. So we will release a call to action along with these priorities saying, we want to work with you. We want to see what you can do in this, and we want to see what can be done together. So that will come very shortly here, and we'll start to generate those partner action plans. And then in 2026, the CHIP work will begin. This is not a one-time and we're done. We do evaluate this plan. We do look at all the data that continually comes in to evaluate the work we're doing, is it working, and to evaluate if these are truly community needs still. We communicate out all of that information, and then we continually update what we do throughout the cycle. So this is a 5-year cycle. And so we will be partnering with local, our healthcare partners and other partnerships to get this work done in the coming years. That's all I have. Any questions on the CHIP process led by Public Health?
I just want to make a comment. I thought you did an excellent job of explaining all that because it's very complicated.
Thank you.
And I understand a lot of it, but you did a really nice job of explaining that. Thank you.
Thanks. Okay. Well, I look forward to updating you all on our progress.
Yeah, so we'll be hearing from you again once the process, throughout the process, right?
Yes, and as soon as our CHA, which will be a document that also includes all of the data that I discussed, as soon as that's on our website, I will let you all know so you can kind of dive deeper into that and be informed. And then once that CHIP document is written, so our initial plan, those priorities, the goals, all that objectives, those SMART objectives, and what we're going to accomplish or intend to accomplish, once that document is written as well, that will be uploaded and then we can share that as well. So.
Just a side comment, I'm on the board of directors for WestCap, and our needs assessments just came back, and the highest priority was housing, and the second was transportation. And so that, I assume those fit into the social community.
Yes. So, yeah, the first social community condition we called out was safe and accessible housing. And I know economic development, St. Croix County just released their housing study as well. So all of that data is also being incorporated. So there's always good information and then kind of informing future partnerships and work for sure. Yeah. Okay.
Thank you.
Thank you.
Now, number 4.
Which is really number 5.
Which is really number 5. Yeah.
So actually,
Number 4 in the revised menu, Wisconsin Department of Health Services update impact of reconciliation bill on Wisconsinites.
thank you, Mr. Chair. Thanks for moving these items around. It made more sense to start with this one, I believe. My purpose in sharing this Department of Health Services update on the impact or their analysis of the projected impact of Medicaid changes on Wisconsinites was literally just to share their analysis with you and the public so you can see what it is they're concerned about. I think, historically, when you look at memos that come from DHS, they are typically written in a neutral fashion without a lot of, they try to write them without a lot of bias. This report came across to me as one sort of filled with anxiety. So if you've read it, you get that tone, I think, from it. I won't go into detail about it because you've got it in your packets, and I've already talked about a lot of this stuff, I think, over the past few meetings. But what the analysis does discuss is the projected impact of the Medicaid changes, that most of which will go into effect in the fourth quarter of next year, in the federal fiscal year of 27. So October around there of next year. Most of the concern around the Medicaid changes, that is the work requirements primarily that go into effect then, are around the bureaucracy involved and the eligibility criteria that have to be met for people who might qualify for Medicaid, might even already have a job. Many do, but don't have health insurance. And their ability to navigate these new work requirements, that's part of it. The other concern, I think, primary financial concern from the state is around supplemental nutrition assistance program and how that's funded, because those are significant changes that will occur next year around the federal share of responsibility for paying for those services. So the memo outlines general anticipated impact from Medicaid changes, and then it talks briefly about Medicaid expansion. Medicaid expansion is not something that Wisconsin has decided to do. It's something I've advocated for. It's a way to increase the federal share of Medicaid costs and a way to serve kind of the working poor. People up to 138% of poverty would qualify, adults without dependents. So that allows people who are working but not making enough to afford health insurance to qualify for Medicaid. But Wisconsin has not joined as a Medicaid expansion state. The memo says that it's not likely they will. I would say there's about a 0% chance that we will become a Medicaid expansion state. And I think some of those expansion states might be have their own challenges with some of the reconciliation bill changes. The main thing I wanted to just mention, and again, we've talked about this already, but the Supplemental Nutrition Assistance Program, it's called Food Share here in Wisconsin. But the primary financial impact, beyond people maybe having a hard time navigating the bureaucracy or the more frequent eligibility criteria, the main challenge is that, as I said, it's been historically a 50-50 relationship where the federal government pays 50% of the administrative costs for running the program, and the state counties pick up the other 50%. That's going to change to a formula of 75% state county responsibility and 25% federal. So we would lose, as a state, we would lose 25% of the federal support for these programs. The other challenge around it is that the memo points out, and that the next agenda item will speak to, is that in order to, so there's work requirements already in place for food share. People already have to meet those work requirements, but the age range is expanded. So it's no longer, I think it's up to age 54 currently. That has changed to up to age 64. We'll have to have the work requirements met. And people with kids 14 and older will have to meet the work requirements that used to be 18 and older. So there's a wider range of people that would now have to meet work requirements. And when that goes into effect, I think now, I don't know if we're waiting still for federal guidance on how to implement changes like this, but I think those changes went into effect when the bill was signed on July 4th. That creates additional administrative burdens for the counties to have to manage more people who need to meet these requirements. Combined with the reduction in the federal share of support, it creates a situation where the fear is that counties will end up with more of the burden of not just covering the federal share, but in building up their administrative staff to meet the extra requirements. And the third thing, the last thing about this that ties in, is that there's a further penalty if the error rate for the state, that is the error rate when determining eligibility for applicants, goes above 6%. And there's a 5 to 15% penalty of the overall program costs that go to the state. So if the errors that can be included in that can be very minor. So it could be a 50-cent mistake that ends up going into that error rate. So the state is concerned that given the additional population that will have to meet work requirements, the reduction in federal support, and the potential for more errors, now that any error can count towards that error rate, would push us into an even a further deficit with a 5 to 15% penalty attached. That's what the state is, in this memo, is spelling out in the last page or page and a half of it. And it's stating that they don't have the money to do that. So that's kind of I think their anxiety is if these things happen as they're scheduled to, it will put them in a very bad place. We've talked about this, I know, so I won't go into more detail about the summary, and you've got it in your packets. But if there are any questions I can answer, I'll try to about this. But I think it gives you sort of a preamble into what the resolution is about that's coming up next.
Any questions or comments? I guess not. Thanks, Bob.
Would the board like me to continue providing these updates as I get them?
Oh,
Or
yes,
do you get
definitely.
them already? I don't know if you do.
Please.
My intention is just to share the information.
Thank you. Number 5, resolution supporting state investment for income maintenance administration.
Thank you, Mr. Chair. So this resolution is really, from the county perspective, asking the state, and Chair Telejohn brought this forward, but if you'd like to explain it, Chair, that's fine. I don't need to, but okay.
You've got a good voice.
It's the concern from the county perspective of the cost shift to counties if the state doesn't support us in these efforts to maintain the SNAP program or food share program, given what I just told you. So the request or the resolution sort of spells out some of the things I just mentioned, but it's urging the state to provide financial support so that counties and taxpayers in counties aren't footing the bill for any additional costs, primarily around the administration of the program, which will lose funding from the federal government. So we're, in the resolution, that's what it's doing. It's asking your support or the board's support for urging the state to financially support us so that we're not, as a county, covering all of these additional costs. Did I explain that well, Chair?
Yes, you did. Go ahead, Kathy.
I move to approve the resolution supporting state investment for income maintenance administration.
I second it.
There's about a motion and second to accept this resolution. Is there any discussion?
Just questions. So if the state doesn't have the funding and we ask them to come up with the funding, where are they going to get the funding?
That's going to be, from this resolution's point of view, their problem. Now, it may be, I don't mean to be making light of this, but Supervisor Barklow, I think the reality of it is it'll be robbing Peter to pay Paul, but we don't want, I think the resolution is saying we don't want the burden of these costs to fall on taxpayers in counties, and counties a lot of times end up picking up the tab when there's a shift like this with federal funding. So I think that's the urgency behind it.
I mean, do you foresee that we're going to have to offload people that are on these programs?
Not people on the program, but the people that administer the program. They'll have additional workloads, and there will be additional people that will have to be monitored because of the work requirement expansion. So it would be a situation for us where we would have to consider, do we put more tax levy to support what we currently have, or do we reduce our staff, which would really make it almost, I don't want to say impossible, it'd be near impossible to manage the program. And if we do that, then the error rate goes up and the state pays more and it trickles down. So we're trying to prevent that cascade of cost to us. We're not, the resolution is, but we are too. Yeah.
Kathy.
So I know you've told us this before, but the number of St. Croix County residents on food share.
Yeah, that might be in the resolution itself, Supervisor Leaf. I'd have to look.
I know it's a pretty significant number of our friends and neighbors who are working and can't still make it, which is unfortunate. given how plentiful our economy can be in St. Croix County. Anyway, I'll get off my soapbox. However, I'm wondering where this goes next if it's approved. So where are we sending this? Does it go to the counties association or does it?
It says, if you look at the last paragraph, it says, once, if the board approves it, it goes to the governor
I should have read ahead, sorry.
and the legislature and counties association.
And again, I'll mention my connection to West Cap. We're very concerned at West Cap for the 7-county area that SNAP is going to be prohibitively expensive or not at all. So we're wondering from that perspective, what's going to happen on a broader basis. So for the 7-county area. Any other discussion? Go ahead, Sean.
A couple things. I'm not normally for symbolic, or not symbolic, but non-binding resolutions, or but this is something that like has a direct impact on the county's financial burden, and it's something that can be affected one level of government above us. So I think this is one of those exceptions to the rule. The one thing is, why wouldn't we, I guess question is, why, is there a reason why we wouldn't want to send this to each county individually? Is that just a lot of extra hassle?
I think the county association provides copies,
Yeah.
but I, to be honest, I'm not sure the process.
That might be where Christine gets all those from,
Yeah.
from the counties association.
If that's the standard process, then yeah, I guess.
But I agree with
Yeah. I
Yeah,
would
this
just,
is going to go to the Wisconsin Counties Association.
who will then just forward it to a mass group they have
Right,
with
and
all the
it'll be,
clerks and.
put it on their priority
Yeah.
list. I mean, when we go down there on Sunday, there'll be a business meeting now of the resolutions to be voted on from the county association.
Sure.
So this'll, it won't make this round, but it'll be, it'll,
But would this be, I guess, one of those emails that we get from, when other counties pass resolutions?
yeah, well, or we can
Christine.
ask Christine to pass it on to other counties too, I assume, so.
Yeah, I would just change the be it further resolved to include other Wisconsin counties or something. I guess I'll make a motion to amend it to add,
Distribution to other counties.
yeah, so comma, all other county clerks, comma, and the Wisconsin County Human Service Association after the Wisconsin County Association.
I would second the amendment.
There's been a motion and a
It's
second.
in there, the final sentence, with a constituency within St. Croix County, the Wisconsin Counties Association, the Wisconsin County Human Services Association. So it is in that, be it further resolved that that's where it would go to once it passed our county board, so.
Could I just add one thing too? The county association was promoting this type of resolution amongst every county.
Oh, so they made all the
They were
counties
making
aware
a push
already.
for these
Okay.
kinds of efforts.
Okay, that's fine.
So we're going to ignore the amendment?
Well, we should vote on it as a
Well, sure.
formality, but. No, that's not a thing.
So there's an amendment to the motion to add distribution to, for us to distribute to the other counties.
I would recommend we fail it.
Fail it, yeah. Okay,
Because it's
all,
already covered.
yeah, all in favor, say aye.
Aye.
All opposed, say aye.
No.
Aye.
Motion fails. For the amendment. Now for the maiden resolution as presented. There's a motion and second. Is there any other further discussion? Hearing none, all in favor say aye.
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 Opposed? Motion unanimously passes. Thank you. That's it for business items. Any other future agenda items that anybody would like to see added to the agenda next time?
I'm not on the board, but I have a suggestion if you're interested. It would be a review of the final report for the sequential intercept model mapping project that we took part in with Justice Support Services a month or two ago. That final report is out, and we're currently going to discuss it in the Criminal Justice CJCC Behavioral Health Subcommittee next week. So we would have recommendations to bring forward. But Phil Golly, Dr. Golly from Justice Support Services would be willing, I think, to come in and help present that if you want it on the agenda.
Yeah, definitely. So, any other requests? Any announcements?
I had some, but I forgot. They're in a notebook in my office. I'm sorry.
Send out an email.
We hired, oh, yes, one. We hired a public health strategist, started Monday. Name is Genevieve Palazzolo. And she comes from Michigan, near Detroit. Master of Public Health with a background in epidemiology and many other things. She seems wonderful. So she's just getting acclimated right now to the department. But yes, thank you, Ellie. Thank you for giving me an announcement.
Hearing no more announcements, our date of our next meeting is scheduled for October 15th, and we are adjourned. Thank you.
Your last one, yeah. You too.